We're out here picking some blackberries. Got my handsome man with me. And over here, some nice, yummy, delicious blackberries. Oh my gosh. They're so fat and juicy. I can't wait for you to be big enough to try these, EJ. I'm going to make some blackberry jam or something. But oh my gosh. I love it. Alright, we're going to do a video. Hi, welcome back to Herbal Bunny's Pharmacy. I'm going to share something with you guys and talk to you about something that I don't think that they talk about nearly enough, if at all, for women who have given birth, particularly ones that have had a C-section like myself. So I started having these symptoms where at night my hands would start tingling and I started having this weird numb sensation in my thumb, and I'm like, okay, is this carpal tunnel? I've never had this issue before. And so I was asking around. I told my doctor. She didn't think it was anything pregnancy related, so she told me I need to go see a neurologist. Like, okay. She said it could be because I've been overly using my hands, or maybe it's the way I'm holding the baby, whatever. Sorry, I'm like I'm picking my blackberries. So I didn't want to do unnecessary trips to different various doctors, so I decided to do some research on my own, contact my professor, just to kind of see what she had to say. And apparently, if you have had a C-section or given birth vaginally, this could happen as well, that there's proteins that from the placenta and your amniotic fluid can get mixed into your bloodstream and cause various different problems. In med school, I do remember that they talked about people who have been in car accidents or have had a broken bone, that some of the bone marrow and the bone particles can get mixed up in your bloodstream and cause some like personality changes and cause emotional issues. So I'm like, okay, well, this would make sense that if you're giving birth vaginally, you know, if you're tearing, you know, baby's placenta or the amniotic fluids, things like that can get mixed up into your bloodstream. And it's more so when you're actually having a C-section, because you're being cut open and everything's there, your blood and your vessels and your nerves and all that stuff. So it makes sense. But what doesn't make sense to me is that since this is so common, why is it not talked about with patients? You know, one of my friends, you know, her baby's 14 months old. She's having some shoulder issues. And in my research of this, you know, she's been going through physical therapy and everything for a couple months. And I was like, you know what? I bet you this here has something to do with that. So she started researching, looking at some of the symptoms, and it's making sense to her. Why is this not talked about? Like, I think doctors are really doing us a disservice if they're not talking to us about other possibilities. You know, my cousin had a broken arm, and they mentioned to them, the parents, about there could be some issues. You know, there's the emotional trauma of having a broken arm or leg or whatever. And there's a lot of trauma when you're having a baby, especially if you're having a C-section. Why is this not talked about? Like, why is this not a discussion that doctors are having with their patients? Also, in my research, and this definitely was blowing my mind, but it makes sense, that when you get these particles in your blood, it triggers an immune response. So guess what? If you have an autoimmune condition, this can cause a flare-up. I have POTS. So, and my friend, she has an autoimmune condition, and so this causes inflammation in your body. So again, if your patient has an autoimmune condition, this definitely should be something that is brought up to them, that there could be this possibility of having these different pains, an autoimmune flare-up, that you could have nerve issues, your nervous system issues, and that it's going to cause extra inflammation in your body. And that's basically what's happening. And it's just baffling that doctors are not actually talking more about this. So I'm, as a doctor, am telling you that if you've had a baby, you've had a C-section, and your autoimmune condition has flared up, or you're having extra pains and stuff that, you know, you don't think is related to it, you're having more anxiety, because this also can trigger more anxiety, which it has in myself, then it could be because of these proteins and amniotic fluid, other things that's getting into your system. So what can we do about it? That's what we're going to talk about next. So the doctors, their solution for this is to give a corticosteroid shot. And this helps with inflammation in your body. It doesn't actually help to get rid of these proteins and stuff out of your system. Eventually they will get eliminated, but let's try to figure out how can we get rid of those naturally and not have to take these steroid shots that can cause other problems, and especially if you're diabetic, because these steroid shots can also increase your blood sugar and have a plethora of other issues that can go with the shots in and of themselves. So what I'm going to be doing is really boosting up eating healthy anti-inflammatory foods, such as the blackberries, and eating more greens, and really watching sugar. Sugar causes inflammation, so I'm eating the fruits that are low on the glycemic index, which berries are. And I've talked about berries in other videos where, you know, if you're cleaning out your liver, I think my last video was the liver detox thing. And the berries really helps give you antioxidants. They fight free radicals, they fight viruses and things like that. So I'm going to be doing some green juices to help flush out my system, and just seeing how that's going to go for the next 2 or 3 weeks. I'm going to try that to see if I start feeling better, see if I can get some of the inflammation down, and see if the numb and tingling feeling starts going away. Starts to go away. I want it to stop and go away. Baby's looking. Do you see yourself? You see mommy and you on a camera? Oh yes, there we are. Mama got her little kangaroo pouch with her little handsome man. Yeah. And we're just gonna see how that goes, and just try to help reduce my stress as much as possible. You know, when you have a newborn, an infant, you know, the first year or so is pretty hectic. So just trying to reduce my stress and everything. You know, I've gone back to work, I'm taking care of my mom, and so that's been a little stressful on me. We've had some health issues with her, and that's probably not helped at all. So, but I'm just doing my anti-inflammatory diet right now. So lots of berries, and gonna be doing some green juices. As herb-wise, I'm breastfeeding, so we do have to be careful with the different herbs that I'm putting in my body. But dandelion leaf tea is definitely okay for me. Chamomile, I have to watch out for the different things in mint family, because mint can reduce breast milk production. Milk thistle, and I do not the burdock, but the what is that one that's always growing around here? It's like literally all around me right now, and I can't think of the name of it, but yellow dock, yes. Yellow dock, it's got the yellow roots, and that really helps to clean out liver and helps with any inflammation. So and it helps with the uptake of iron. So we definitely need more iron, because when you have an inflammatory response going on in your body, your iron is getting gobbled up. So that is going to be my solution. I will let you guys know how all that goes, and just look into it. I'm going to post down in the description the names of some of these conditions, you know, with like the shoulder, like my friend's having the shoulder stiffness, and she's like, it feels like almost arthritic. And like same way with my hands, like I feel like I have arthritis setting in my body, and it's because of these proteins that get mixed up in your blood with the placenta, with the afterbirth, with all the amniotic fluids and everything. So, and it makes sense. It makes sense. And getting your body to detox that out of your body and everything. And also, there has been a link to that with postpartum depression. Makes sense. It really does make sense. And why is this not talked about? Because there's no money in it. So, anyway, my opinion. My opinion only, I guess. Yeah. But I will let you guys know. And thanks for watching. Go ahead, share the video, because this could be very, very useful for somebody else, especially if they just were kind of shoved off, you know, left off like I was. You know, go see a neurologist. I'm like, they're going to want to talk about carpal tunnel surgery. I don't want to do that, because, you know, there has to be a correlation, and there is. And I'm going to figure it out. And if it doesn't, you know, solve the problem, then I'll probably do research on something else, you know, and figure out another remedy or whatever, because I believe that the body can heal itself, and that's what we're going to try to do. And yeah, and keep this little guy healthy too in the process. He's got the hiccups. All right, you guys, thanks for watching. Like, subscribe, and share. And EJ says hi. You got the hiccups.